Everything in our world has an electromagnetic signature. This is not woo-woo science now. This is demonstrated.
One of the things I've noticed in my experience is that I think we do tend to think that people know this stuff, and I think they don't actually know it in the way that we think they do. So
Yeah, with emotions causing these physiologic symptoms, let's just say, or manifestations, it also impacts your immune system.
Sometimes we need to be sad, of course. Sometimes we should feel anger, and, denying that is actually taking us to the place that we're talking about. So it's important that we accept those emotions, even if they are uncomfortable for us. So how do we shift ourselves from that sympathetic nervous system to the parasympathetic nervous system? How do we make that shift?
It's a very complex question. And
I know that. Dr. Olivia Lesslar, an Australian-educated medical doctor with a background in psychoneuroimmunology and longevity medicine. She specialises in tackling complex, multi-systemic conditions such as neurodegeneration, allergies, and autoimmunity, using a unique blend of integrative approaches and cutting-edge science. Dr. Olivia collaborates with top international clinics, including clinics in Los Angeles and Sydney, lectures at leading institutions, and is a sought-after expert in biohacking, neuroplasticity, and preventative health. Get ready for an insightful conversation on optimizing your health. Hello, Dr. Olivia. Welcome to the show.
Thank you.
Thank you so much for coming. I love your backdrop there. Can you just explain where you are right now for those who are listening? Because I love it.
I'm in a
Totally fits with
sauna.
our topic. You're in a sauna. Isn't that
In a
awesome?
It's
Is
not
it
on.
on?
Although, no, actually, you know what? I did do a meeting in a sauna, and it was like an hour after I turned it off, but I
Yeah.
was still sweating, and it was with a psychologist, and it looked like I was in the hot seat, and I'm like sweating. And also, I'm staying at a friend's place, and I thought this might be the best place to be to not get disturbed. So anyway, I'm in a sauna.
I totally understand. It's the perfect place for sound, actually.
Okay,
But I
good.
love that you're doing an interview in the sauna. I promise you're not in the hot seat today. We'll be nice and cool and casual. So tell me a little bit about what you do and why.
So, I guess, look, I went through all these like iterations of who I was when I was trying to explain what I do. I went from being a functional medicine and integrative doctor, biohacking, longevity, and I've just gone back to saying I'm a doctor because I feel like this next phase of human health, well-being, longevity, we need to sort of reclaim the word doctor because I
Mm.
think very few people now think of a doctor as being a pill pusher. They think that doctors should be an integral part of that wellness journey and, up to date about these alternative or biohacking hacks. Well, like sauna, for example, or photobiomodulation, or things that people, because of the internet, know all about. And if you're a doctor and you don't know about these things, and the only thing you really know about is prescription drugs, then I, I think that we deserve more from our health professionals. So I've gone back to just saying I'm a doctor, um, to try and reclaim that word. I don't say I'm a functional medicine doctor. I don't say I'm an integrative medicine doctor. And sometimes I do it to try and help patients find me, but I am just
Mhm.
a doctor. My expertise or my interest is in something called psychoneuroimmunology. And that is that intersection point between psychology, emotions, the nervous system, neuroscience, endocrinology or hormones, and the immune system. And that's because everything's connected to everything. And we all know that, doctors and patients alike. But now we have the information to back up that everything is connected to everything. And AI really does help that too, to be honest with you. And of course, it's because I'm asking questions uh, about what I'm seeing in clinic with patients who are either getting better despite, their circumstance, or patients who aren't getting better despite having the best treatments. And the missing piece always wound up being something psychosocial. And so I got really
Mhm.
interested in that. And the literature is kind of buried in psychology and social sciences. And being at a, you know, allopathically trained in a conventional university, I wasn't exposed to that kind of information. So I'm sort of dragging that over to medicine.
Mm-hmm.
And then my second interest now is in quantum medicine, quantum biology. And I'm trying to, at some point this year, figure out how to merge the two. So I'm very new to the quantum world, and there are lots of people out there who are blazing the trail. And essentially, it's looking at light electromagnetism and how it affects health and wellness. I think from a functional medicine perspective, let's just say people are on biohacking, people are already talking about non-native EMFs. So we all know that.
Mm-hmm.
But when you really start delving into it, this it's a literally it's a whole new world.
That, I love that you have reclaimed that title of doctor because I totally agree with you. Like the landscape has changed so rapidly over the past decade, and I think we know so much more. Or I agree with you. I don't even know if that we know so much more, but the evidence has caught up with what we know, and so I love the idea that you're talking about that everyone should be in that place where we are operating from a holistic approach, where we're looking at all elements of mental well-being and health and wellness and tying all that together because it's so important. It's so fundamental to what we do.
Mhm,
I wanted to ask you, can you explain a little bit more about that connection between emotion and physiology?
mhm. Well, um, I think everybody knows, that when you are angry, that you wind up sweating more, or when you're sad, there's this liquid that comes out of your eyes called tears. So emotions will have an effect on physiology. How much of an effect on physiology is what we're really starting to understand, because that physiology is being um, sort of orchestrated by the autonomic nervous system, and that's the nervous system, right? So I think we all know about fight, flight, rest, digest, and freeze, fawn. So that's going to be
Mhm.
your polyvagal theory, and the that's orchestrated by the dorsal vagal. Um, and with emotions causing these physiologic uh, symptoms, let's just say, or manifestations, it also impacts your immune system. And that's where it comes into play for a lot of the complex chronic condition patients
Mhm.
that I see, because your emotions are going to, in part, dictate how well your immune system works, how well your hormones function. And then,
Mhm.
of course, your emotions are going to have something to say about your behaviors, and your behaviors are going to impact your immune system. So, what I mean by this is that if you are very angry, and when you're angry, you're in a sympathetic state, which means that you are in a fight or flight state. And when you are in a fight or flight state, you are not in a rest and digest state, which means that you're going to not digest your food that well, not absorb the nutrients, and you're not going to be
Mhm.
able to relax, which means that you're not going to be able to sleep that well. And if you don't sleep well, you're not going to get into that deep sleep. You're not going to get into that delta wave sleep, slow wave sleep, which means you're not going to open up your aquaporins in your brain overnight. And the cerebral spinal fluid isn't going to go through, and it isn't going to clean up your brain. And you're going to be left with some of that sticky metabolites, right? And if you do that often enough, long enough, that is a risk factor for dementia. So that's a really easy example to show how an emotion that's not kept in check, um, that has been left to essentially poison you, can lead
Mhm.
to a disease state. So is anger in and of itself bad? Of course not. Is regret or guilt or whatever, is that bad? No, it's in context. It's, you know, is a behavior changing because of it? I mean, that's what we're meant to do. We're meant to adapt to our circumstances. We're meant to learn from the social settings and the lessons that come up in life. It's when we don't have any control and these things fester, that's when it can be a problem.
I absolutely agree. I find as a couples therapist, it's so prominent in the room. So when we are seeing couples obviously so activated in fight, flight, freeze, and so much of my work is around psychoeducation about that and really helping people in the moment to be able to regulate and come back down and come to a state where we can make effective decisions and have effective communication. But one of the things I've noticed in my experience is that I think we do tend to think that people know this stuff, and I think they don't actually know it in the way that we think they do. So,
Yep.
I've found myself going very much back to basics with
Yes.
that information because I think that we assume everyone knows what fight, flight, freeze means, and I think they do to a degree. Like I think people get that concept, but if you're talking about what's actually happening in your body and the long-term impact of that, I think people don't have that same level of awareness.
Yeah.
And I think the other thing people miss is that chronic underlying anger. So there's sort of I get that in the moment when I'm very much in fight, flight, freeze, it's very prominent. I can feel the tension in my body and maybe I'm in a fight with my partner or I'm having road rage or whatever it is, it's very prominent, the emotion. I think that's when they tend to have some level of awareness or develop
Yes.
that level of awareness easier. But when we talk about that chronic underlying sort of anger where we are
State.
suppressing the emotion,
Yeah.
yes. So we are suppressing the emotion or we are surrendering into it. Um, I think people don't always understand the impact of that over
Mm.
time. Can you talk a little bit about that? I know you have, but I just really want to delve into it because I think it's so important for people to understand this.
Yeah. So there's the acute outburst of, let's stick with anger because we're talking about that. The acute
Yeah.
outburst of anger, the one that you feel the heat, rise in your body, in your face, right? And you need to expel energy, so you hit or you throw or you yell.
Mm.
There is also state anger. In other words, it's your like baseline, where you've gone back to a neutral, but if something happens, you go into anger. Like it's your default state to fall into, right? And those are really dangerous because those are the ones that wind up having devastating effects on the immune system, on the hormones, on your behaviors, exactly like we described previously.
Mhm.
I think that we all know someone who's negative, right? Or who has a tendency to be negative. And that can be just as poisonous because every emotion has a vibration to it, an electromagnetic frequency to it. In fact, everything in nature, everything in our world, every pill, every material, every emotion, every thought has an electromagnetic signature. This is
Mhm.
not woo-woo science now. This is demonstrated. Like, as you know, I'm the director of functional and longevity medicine at a brain center in Sydney. And what we do there is connector mapping of the brain and then transcranial magnetic stimulation to induce
Mhm.
neuroplasticity. Now, all that is just fancy words saying I use electromagnetic fields to affect change in a biological structure, right? And so I'm very interested in electromagnetic fields, and there is a company that I've been following quite closely for the last, well, since 2019, called Emulate Therapeutics. They're in the US. Um, and it's because I came across this company when I was at a brain tumor summit at a conventional hospital in New
Yeah,
York in
wow.
2019.
Yep.
And one of the issues that they're tackling is brain tumors because notoriously medications don't cross the blood-brain barrier, which is the main issue with trying to treat brain tumors. And
Mhm.
what this company has done is actually taken the electromagnetic frequency signature of the drug, encoded it, put a coronet on patients, which they wear for 23 hours a day, and it spits out the electromagnetic frequency to affect the drug's to have your drugs effect on the brain. And they just
Wow.
finished their pilot studies at a university in Melbourne, actually, maybe a couple of years ago. And yeah, so I'm following them because this is the next phase of medicine, right? Um, anyway, so when you are a person where your baseline is a negative emotion, right? And I use
Mhm.
inverted commas because I think we're too willing and ready to slap the word positive and negative on emotions, on behaviors, where some of those emotions or behaviors can actually be um, quite helpful in certain situations,
Mhm.
right?
Mhm.
And then
Yep.
in other situations, they're maladaptive. So we have to
Yeah,
be very careful with
completely.
how we label these things. But
I
anyway,
agree. I often use
so
the word uncomfortable because it's
yeah,
that uncomfortability that people struggle with versus that, sometimes we need to be sad, of course. Sometimes we should feel anger and,
exactly.
denying that is actually taking us to the place that we're talking about. So
Right,
it's important that we accept those emotions even if they are uncomfortable for
right.
us.
And if we know that, as per our previous example, that anger has a certain effect on your physiology, right?
Mhm.
Then you have to imagine that if that is kind of like a baseline uh, state,
Mhm.
then physiologically things are going to change in that in line. Because if you want to go back to some basics, because I totally agree with you, right? Going back to basics is super helpful. And it's super helpful for me in trying to get my head around this, right? And I'm still
Mm,
learning.
me too.
All these
We're all
things,
still learning.
well, the thing, all these states, all these emotions, all these thoughts, they actually are just signals to your body about resource allocation. Where are you going to put your resources to uh, s- minute by minute? So if you're angry and you go into that fight flight from an evolutionary perspective, it's because there was a threat and you had to
Mhm.
face that threat, whether it was to fight it, to run from it, and then later on it became to negotiate with it, to discuss, right? But your body had to allocate resources. Sugar would be an obvious thing, but energy would be another. And when it's reallocating resources to help you deal with this threat, this nebulous threat, whatever that threat was, then it's taking resources from other things which may have needed it. That includes repair, regeneration. So think about it from a resource allocation perspective. And if you're always sucking resources from organs or from cells that need it for just general wear tear purposes, and you're squirreling it away to this threat that never seems to be gotten on top of, never seems to disappear, never seems to be quelled, then your body gets exhausted. But its
Mhm.
primary function is survival for you. So it will keep giving those resources in this to your state of preparedness. You know, back in the day, it was so that you could run or fight, chuck a spear, something like that. Now it's so that you can yell at the waitress at Cheesecake Factory, right? But it's this constant allocation um, of resources to your state of needing to be ready to pounce, to yell, to punch. And that will exhaust any system over time.
So how do we shift ourselves from that, we're talking about that fight, flight, freeze, that sympathetic nervous system to the parasympathetic nervous system. How do we make that shift? What are some things or a couple of things that people can do to shift themselves out of that state?
Well, I think it's a very complex question. And
I know that.
it,
So, yeah, I was like, how's she going to
I
answer this
think
one?
it's a complex one. But I think that acknowledgement is the first step, right?
Mhm.
To start realizing that constantly being negative Nelly or constantly being kind of that angry, gruff kind of personality. Oh, I didn't realize being this way might have knock on effects to my
Mhm.
health, right? So that's the first step. And then it's about awareness. I mean, I love, breath work and meditation and talking to professionals like yourself, because the awareness piece of it is so important. I don't know what I don't know. And the only body that I've ever been in, well, in this life, is the one I'm in, right? The
Yeah.
only childhood I've experienced is the one I grew up in. The only parents I had to model are the ones that I had. So I don't know how else to be until you start interacting with people and observing and seeing and having curiosity and speaking and reading and learning. So this acknowledgement and then starting to become more aware, that's super important. And you'll be so surprised with, like, I'm talking from personal experience, right? The minute you start having your eyes opened, or when you open that door, you can't unsee what you start to see.
Mhm.
And then your own body, brain, mind starts to put those pieces together and you come up with a more cohesive, comprehensive understanding of the outer world, but also more importantly, the inner world. And then you can make changes that feel appropriate for you. So, I mean, I'm gonna jump into my own stuff, but like, I have I'm a giver, right? I give emotionally, like 110% straight out of the gate. And then the minute people start to make me doubt in any way, shape, or form, then I start to pull back. Now, I thought
Mhm.
everybody did that, but when you're in relationships with people, you realize actually people don't do that. Some people, they are cautious, they figure you out first, and then they start to give more and more, right? Um, and then you go, "Oh, well, I wonder if that would work for me." Because if you get burnt a few times, then maybe what I'm doing isn't right, or isn't right for me, isn't right for the
Mhm.
circumstances I find myself in. And then you can experiment with other behaviors. So I think it's definitely acknowledgement and then being curious, which will then lead to you figuring out solutions for yourself. Speaking to professionals is always handy. Like when I was saying that I was in the sauna the last time with a psychology colleague of mine, I was learning so much from her in just that, 90 minutes that I had with her. Um, but that's, life is just this lifelong journey of discovery. So I'm only halfway through.
I love that.
Mm.
I think, we can overcomplicate things. And one of the things I love listening to you, obviously now, but some of the other content, so definitely jump on your social media and check that out, is the simplicity of what you offer. You don't overcomplicate things, the solutions aren't overcomplicated. And I think that idea of, when we're in that reactive moment, really it is that simple. It is developing awareness and then using a very simple, breathing technique to bring us out of that state of physiological arousal. And if you're listening and you're like, what's a breathing technique? You can just Google it and there will be a ton of
Yes.
options. And I'm sure you'll agree with me. It doesn't matter which one you do. There's no
Yes.
perfect kind of breathing technique.
Yeah.
There is just the one that works for you. So
Yeah.
if it's, a mindfulness activity, that's a grounding exercise, whatever it is that works for you, if it resonates, then that's what it is. That's the
Yeah.
best thing for you. And I think in terms of that, that long-term kind of shifting of that state, I want to talk about your 9 principles of well-being, which again I came across on your social media. I was stalking you a little bit, so sorry.
I
I
love it.
think the talk you were giving was actually to, I don't know, if it was, but my assumption was it was to a group of maybe doctors or
Practitioners,
to
yeah.
some audience, yeah. And the reason it stood out to me is because you had on there wine at 5. And I have to say, I have never, ever, ever seen that on a wellbeing chart. I've seen a lot of different wellbeing frameworks. Never have I seen that. And I loved it. It resonated for me. Not that I have a wine every day, but I've been in Bali for 2 years. So coming back to the Mornington Peninsula, which is a wine region, I'm definitely, very interested in incorporating that to my wellbeing routine. Uh, because barley wine is terrible. It's ridiculously expensive and not great. So, it did jump out at me. I was like, but, obviously that was the first thing I saw that grabbed my attention. And then I looked at it, and for me, obviously as a psychologist, the thing I loved was that is such a holistic approach to well-being. So there was obviously parts around our physical health, but a lot around our emotion and relationships and connectedness. So I would love it if you could talk us through that
Yeah.
blueprint.
Yeah.
I'm not sure if
Okay.
it's called what you call it, but the sort of 9 strategies around well-being.
Okay. So disclosure here that's actually the Power Nine from the Blue Zones work. So
Okay.
Dan Bretner's work, they have something called Power Nine. I
Mm.
modified it a little bit. Um, okay, so the original Power Nine is downshifts, so that's stress relieving strategies, and exactly as you said, Katie, whatever works for you. Because when I'm talking to my patients about the mindfulness strategies or the breath work or whatever, part of it is not just whatever it is that sinks to you. Part of it is that you've taken control. You have agency. And that's that in and of itself, the very fact that you've said, I'm going to look for something that's going to help me in this situation, or I'm
Mhm.
going to do something to get myself out of this state. That's like half the work.
It is. It's huge, actually.
So it's downshift, it's purpose, plant slant. So majority of these blue zones in the world consume more plants than not. Wine at five, except for Loma Linda. Family first, the 80% rule. So you finish eating, you stop eating when you feel sort of 80% full.
Mhm.
Moving naturally, so getting out there in nature, walks, gardening, whatever. Having the right tribe, the people that you feel close to. Belonging, so in the context of Power Nine, then Bretton's work, it's religion. So is that nine? 1, 2, 3, 4, 5, 6,
Yeah.
7, 8? Yeah. Now, Dan Bretton's work and the blue zones are those countries, those places, sorry, around the world that where there is an inordinate amount or very large number of people who make it to 100 years old. So
Yeah,
the Blue
wow.
Zones research group went out there and spoke to them and observed them and this and the other. Now, there's a lot of controversy around the Blue Zones, you know, but I don't want to get into it. To people talking about um, faking death certificates and whatever. But the Blue Zones include places like Okinawa, Loma Linda in the U.S., Icaria in Greece, Sardinia in Italy.
Mhm.
And you'll find that it's not about supplements, drugs, or going to the gym. So I modified it a little bit because I think that while plants or like a plant dominant diet can be very helpful for most people, certainly in my practice, I have found that not to be the case for some of my
Mhm.
patients.
Mm.
And hence why I change plant slant to, um, making sure that it's sustainable and local and traditionally prepared
Mhm.
and seasonal, organic. Just I
Yep.
want people to enjoy their food more than this orthorexic thing that we have at the moment. And orthorexia refers to this new diagnosis, basically, of patients being so concerned with eating right, it becomes pathologic. It's the person who you go to the restaurant with them, and they're, is it gluten free? Is it this? Is it that? Oh, I can't have that, can't have that, this, that, and the other. And
Mhm.
this is not a sick person. So it's not someone who needs to have a special diet for any reason, but you get yourself in such a state. Now, do I think that food is medicine? I absolutely do. Do I think that there are lots of things in our foods now which are undesirable? Absolutely. But I have also seen patients, and why I'm so interested in PNI, psychoneuroimmunology, I've also seen patients do well despite all that stuff in their food.
Mm.
Because
Mhm.
you are probably very familiar with Alia Crumb's work more than myself, but the work of Alia Crumb and her colleagues in the world of psychology is that your body will react to the food if it thinks it is one way or the other. The placebo and nocebo effects are very, very real, especially when it comes to food and diet. And anyway, going back to the Power 9, and
I
I
do love, though, that you touched on that because I think it's so important. I did a placement in the Royal Children's Hospital Eating Disorder Clinic.
Mhm.
And so
Oh,
sort of a lot of that fear around food and orthorexia. And I think it's something that's probably not talked enough about in when we're talking about eating well, and people can get so fixated on finding the right diet. And there's a lot of information around that. It's really overwhelming for people,
it
and
really is.
it
Yeah.
does develop a lot of fear around
Mm.
food, which is the exact opposite relationship that we want to build with food.
Yeah.
And and as you said, we can then sort of not manifest the right word, but as soon as we start directing our thinking around this thing will make us sick, then we
Mhm.
can start to see symptoms align with that,
Yes.
like pains in our gut or you know even just the kind of anxiety around food.
I don't use food to help change because everything's that bidirectional. And that's why P&I is so important because it gives
Absolutely, yep.
practitioners and patients alike more levers to pull. So if you
Mhm,
have a sensitivity, not an allergy, right? Not a out and out IgE allergy, angioedema, hives, all the rest of it. So if you have a sensitivity to gluten, right?
mhm,
One way to deal with that is to eat gluten-free bread, let's just say. And the other way is to not have any breads at all.
mhm,
Then a third way would be to have a supplement like gluten guard or something like that, where you eat bread and then you have gluten guard, and then it helps with breaking down gluten. Then the other things are to shore up your immune system, or shore up your gut, so that if you were exposed to gluten, it wouldn't be so bad in inverted commas.
mhm,
And then the other thing that I see in practice is that patient sensitivities, whether it's to gluten or to dairy or to salicylates or to, other biogenic amines or whatever it is, it's always worse when they're stressed because
yes,
the
yeah,
body does, um, when it's in a heightened state of alert, when it thinks that there's a threat coming through your major guardian site, which is your mouth, it is going to look for that pathogen. It's going to look for that threat. And when your immune system is on the hunt for something, when your immune system is looking for a fight, it will find one. So the levers that I sometimes pull with my patients is, okay, what are you willing to do? You got to meet the patients where they're at. Not everyone can change their diet. Not everyone wants to change their diet. And I'm
mhm.
not here to judge. I'm not here to, to say, well, this is my protocol. You have to do it, or you go see another doctor. Like that's, and
You do
uh,
it my way, you do life
yeah,
my way.
yeah, exactly, right. Um, and that's the
It's so
beauty of
important
PNI.
because I think that people do have that assumption of, and I think to be honest, like I think it's one of the things that stops people seeking help sometimes
Yep.
is that they think that they're going to be told that this is the only way that they can do things, and they're not
Mhm.
ready for that aspect of change.
Yep.
And so I think that that is such an important thing to highlight is that as practitioners, our goal is not to tell you what to do. Our goal is to understand your world, to understand how you interact with life, what's important to you, what's your values, and to work with you on how to get you to where you want to go, not where we have this predetermined of idea of what your life should look like because
Yep.
we're not living it, you are. And so
Yep.
I think that's such an important concept to address because I think that a lot of people do have these very strong ideas that if I go see a doctor, they're going to tell me this.
Yeah.
And I'm just not going to do that. So I'm not going to go see them. Instead
So
of seeing like we can go and have a conversation about like what you can start with and what works for you.
right, right. And then of course it's also knowing what patients' goals are, right? Because we
Exactly.
always assume that patients wants to be, I mean, of course the the moonshot is that patients are 100% healthy and that they don't have disease but knowing what their short-term goals are very important. So it may not necessarily, if you have an autoimmune patient, it may not necessarily be that short term they want to be free of their rheumatoid arthritis, right? That's of course
Mhm.
a longer term goal, but in the next few months they just want to be able to pick up their granddaughter.
Yeah.
Okay, and working these baby steps can be really helpful because exactly what you said, not not everybody's ready for the kind of big changes that may be necessary to get them from A to B. And we need to
Mhm.
stop assuming that they want to get to B. Maybe they want to do A.1. What am I talking about? Anyway, but hiking of maybe they're happy with 8.2, 8.3. Maybe they're happy with those little
No,
baby
it
steps
makes
to
sense
get
what
to
you said.
B.
Exactly, but what you're talking about is what's important to them. For that lady that you're talking about who wants to go pick up her granddaughter, that is the important thing in her life, is that I need to be able to drive, I need to be able to get into a car, I need to be able to play with my granddaughter, but I don't wanna run a marathon. I'm not interested in that. I don't need that level of optimum health, and what I have to do to get there doesn't fit with my lifestyle. But what I am interested in is getting to this place of spending time with my granddaughter. So you're
Yeah.
right, like, it is about what's the goal that they're trying to achieve.
Yeah, and that's where this whole, I think, from a integrative oncology perspective, like the number one thing that allopathic doctors or conventionally trained doctors will pull up is this concept of false hope.
Mm,
And it's a sticking point, I think, where they don't think that you should be talking about anything that hasn't been 100% proven in randomized controlled trials that were blind, right?
yes, yeah.
To affect some sort of change that may give them some benefit, because anything else other than that is considered false hope. Now,
Mhm, mhm.
I talk about hope as being the absence of despair, and you can still be dying without despair. So I try to counter that a little bit, because speaking to patients about mindfulness, about the benefits of sleep, or making sure that, they're optimizing their melatonin or IV curcumin or whatever it may be, I don't I don't see that as false hope. But we do also have to be making sure that we understand that the patient understands the the limitations to all these things, including medications and surgery and radiation, right?
Yes, yeah. I think that's something that people don't understand about practitioners, is that it's not that, you don't wanna give that support around a particular, intervention that someone might wanna integrate, but
Mm.
as practitioners, we are limited in terms of it has to be evidence-based.
Uh-huh.
But I agree with you, there's a difference between denying things that you know to be the case. Like, I think, many years ago, we wouldn't have thought, like, connection, for example, that there would be an evidence base behind that to support well-being, but there is now. We know the importance of relationships, but we always knew that, right? Like, we always knew that connection and relationships were important to our well-being, but sometimes the evidence hasn't caught up
Yeah.
to. And I think that that piece you're talking about, the hope, is so important, because if we don't have hope, we are not going to change, like, hope is critical. I find, for me, working with couples, that's my whole start of my work, is around that hope for change, that change is possible. I can't promise it. I can't promise that the outcome is going to be the relationship that they're looking for, but I can give them hope that that is possible. And I have seen those changes.
Yeah. Yeah. Um, I was gonna say something about protocols, actually. So I used to write a lot of protocols, and I still advise clinics about protocols. But
Hmm.
I more and more I try to talk about the fact that protocols are like suggestions,
Yeah.
not something that has to be followed from start to finish, from A to B, because that can put us into quite a rigid state, and it excludes patients' desires, their motivations, where they are as far as change goes. And like I said, like you said, patients may not necessarily want to start with their diet. Maybe they're happy to
Hmm.
start with the lighting that they're exposed to after dark, which will then affect their sleep. And then when they have better sleep and they've got more clarity of mind, then they can, even think about maybe changing their diet. So protocols are handy suggestions, but I'm very cautious about prescribing protocols as if it's like the only way to do things. They're not.
No, absolutely. And I think that's an important message also, obviously, for us as health professionals, but also at the individual level, to know that, if there's information out there that you are digesting and there's parts of that that resonate and parts of that that don't, that's okay. Like, take the parts that do and start there, because as you said, it all impacts on each other. It doesn't matter if we start with sleep or we start with diet or we start with getting more active. It just matters that we start, because it
Yes.
all impacts each other, you know? So we could look at the research and say, oh, sleep is most important. But if someone's not able to start there, it doesn't matter if they start with getting more active. It's going to impact their sleep. It's going to impact their
Yeah.
well-being. It should impact their sleep. Like, it's all interconnected. So I think try not to get overwhelmed with where to start.
When I put up these videos on circadian rhythm, circadian biology, light diet exposure to fluorescence and non-physiologically flickering lights, all that kind of stuff, I will always get messages from people who are shift workers, nurses
Mm,
working the night shift. And they're angry or petrified, right? And my message is always, we do the best that we can with the tools that we have under the circumstances that we find ourselves. Full stop, end of story. And that's for everybody, right? Because I don't know anybody. I don't care who they are. I don't know anybody who lives the perfect life with the perfect emotions and the perfect headspace and mindset and what have you. Nobody does. And
no.
that's the fun part about being in this meat suit on this planet in this life. So, we want a little bit of, how boring would it be if we didn't have any challenges? So
Yep.
that's where the whole self-compassion comes into play. Because the minute you stop beating yourself up about not being perfect, wherever you are on that spectrum, the happier you'll be. I'll tell you that now.
This conversation was so interesting, and there was simply too much to unpack in one episode. So we kept the conversation going. Look out for part 2 coming next week. Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.